Colorectal cancer that is discovered after symptoms appear is often stage 3 or higher. I'll start with the conclusion. This is the biggest pitfall with colorectal cancer. It's been a while. This is YouTube Medical University. Today's topic is colorectal cancer. Even if your health checkups show no issues, you should still be careful. Are you thinking things like, I don't have any symptoms, so I'm fine, or my fecal occult blood test was negative, so I should be okay? Actually, even with advanced colorectal cancer, about 20% of cases are missed by the fecal occult blood test. This is data published by the National Cancer Center in 2024. When the fecal occult blood test is negative, the probability that you really don't have colon cancer is 78% with one negative test. And if both tests are negative, there's an 84% chance that you don't have colon cancer. But conversely, this means that about 1 in 5 cases of colorectal cancer cannot be detected by this test. And there's one more important finding. This is a paper published in 2025 in Nature, the world's leading medical journal. It's a study conducted in the United States and the United Kingdom, covering 11 countries around the world. Japan also took part. Here's what it's about. About half of Japanese people with colorectal cancer show traces of a certain harmful gut bacterium, and those traces were imprinted on their genes. The name of that toxin is colobactin. Simply put, it's a substance produced by certain E. coli that damages DNA. And here's the important part. People who developed colorectal cancer under the age of 50 had 3 times more damage from this colobactin toxin compared to those with colorectal cancer over 70. In other words, colorectal cancer is no longer just a disease of the elderly. This is something that people of all ages should be aware of. By watching today's video, you'll learn how to detect colorectal cancer early, the characteristics of people whose colorectal cancer worsens, and what you can do to prevent colorectal cancer in the first place. This video covers all of that. Please be sure to watch until the end. So here's today's table of contents. Part 1, the real dangers of colorectal cancer. Part 2, 7 common traits of people who lose their lives. Part 3, 3 actions you can start taking today. Especially Part 2 covers pitfalls that highly health-conscious people are especially likely to fall into, so please listen until the end. Colorectal cancer is the most common cancer among Japanese people. It's the #1 cause of death for women and the second for men. But isn't that what many people think? If it progresses to stage 4, it's serious. But if colorectal cancer is detected early, it'll be okay, right? That's true, but there's a big pitfall here. Early detection means finding it when there are no symptoms. Conversely, if you go to the doctor after symptoms appear, it's often no longer early. Let's look at some specific numbers. Data from the National Cancer Center. Out of every 100 colorectal cancer patients, 92 diagnosed at stage 1, 86 diagnosed at stage 2, and 76 diagnosed at stage 3 are still doing well 5 years later. For those whose cancer is not found until stage 4, only 18 are still doing well 5 years later. In other words, if the cancer progresses from stage 3 to stage 4, the survival rate drops to about 1/4. And sadly, most cases of colorectal cancer that are discovered after symptoms appear are already at stage 3 or higher. You feel bloated, constipation worsens, and there's blood in your stool. You've been losing weight. When these kinds of symptoms appear, it's no longer in the early stages. This is the biggest pitfall of colorectal cancer. The 5-year survival rate exceeds 90%. And if it's stage 0, meaning the polyp stage before it becomes colon cancer, you can have the polyp removed as a day procedure without abdominal surgery. In other words, with colon cancer, the survival rate changes dramatically depending on how early it is detected. So if early detection is so important, why is the number of people dying from colon cancer increasing every year in Japan? There are 7 common characteristics among people whose colon cancer worsens. In particular, people who feel reassured by a negative fecal occult blood test, or those over 40 who have never had a colonoscopy, which is the 4th point, should be especially careful. Please make sure to listen to the end for these 2 points. Here at YouTube Medical University, we provide easy-to-understand information from the perspective of active doctors who actually perform cancer screenings and diagnose colon cancer. Subscribe to the channel now. Now let's take a look at the 7 features. 7 common traits of people who lose their lives to colon cancer. Here's the first one. They feel relieved when their fecal occult blood test is negative. First, the first common trait. This is a very important point in today's lesson. They believe they're fine because their fecal occult blood test was negative. People who think that way are at a bit of risk. As I mentioned at the beginning, just because your fecal occult blood test is negative, that is, there's no blood in your stool, doesn't mean you're completely safe. If you get a negative result from a single test, there's a 78% chance you really don't have colon cancer. If both tests are negative, meaning there's no blood in your stool both times, there's about an 84% chance you truly don't have colon cancer. Unfortunately, even if your fecal occult blood test is negative, about 1 in 5 cases can still be missed. Why is that? The reason is simple. A fecal occult blood test is an examination to check if there is blood mixed in your stool. Since the stool sample collected is a very small amount, if there happens to be blood on that part, the fecal occult blood test will be positive. However, if you collect a part of the stool that doesn't have blood caused by colorectal cancer, the result will be negative. A negative result means that it's unlikely you have colorectal cancer. Even so, there is a reason why this fecal occult blood test has been chosen as a cancer screening method recommended by the government. Of course, there is a risk of missing something, but it has been proven to reduce the mortality rate. So, if the fecal occult blood test comes back positive, it's suspicious, so you should definitely get a colonoscopy. In that sense, taking the fecal occult blood test is important, but just because it's negative doesn't mean you're definitely in the clear, so please be careful about that. 7 things people who lose their lives to colorectal cancer have in common. Here's the second one. They only see a doctor after symptoms appear. Blood in the stool, repeated constipation or diarrhea, bloating, pain, weight loss, narrow stools. By the time these symptoms appear, as I mentioned earlier, the cancer has already progressed to stage 3 or higher. In other words, the 5-year survival rate drops drastically from 76% to 18%. That means it's in this area. Even in my outpatient clinic, some patients say, I've had blood in my stool for 2 months, or I thought it was just hemorrhoids, so I kept an eye on it, but it turned out to be advanced colorectal cancer. That kind of thing happens quite often. So unless it advances, colon cancer has no symptoms. Not having symptoms doesn't guarantee you don't have colon cancer. That's not possible, so please remember that it's important to get tested before you have any symptoms. 7 common traits among people who die from colon cancer. Blaming bloody stools on hemorrhoids. It's dangerous to assume that a positive fecal occult blood test, meaning there's blood in your stool, is just because you have hemorrhoids. People who have had hemorrhoids in the past tend to always associate the results of a fecal occult blood test with their hemorrhoids. Let's take a look at the differences between bloody stools caused by hemorrhoids and those caused by colon cancer. Bloody stools caused by hemorrhoids have bright red blood on them. Bloody stools from colon cancer are often somewhat dark in color. With hemorrhoids, blood appears on the surface of the stool. And blood also gets on the toilet paper. With colon cancer, blood is mixed throughout the stool. It's uncommon for blood to be only on the surface. In the case of bloody stools caused by hemorrhoids, there is often pain when you strain to have a bowel movement. Bloody stools caused by colon cancer are often not accompanied by pain. If the bleeding from hemorrhoids is severe, the blood may drip. Bloody stools from colon cancer are usually small in amount, but they often recur and don't go away easily. One important point to mention here is that painless bloody stools require caution. In the case of bloody stools caused by hemorrhoids, they are often accompanied by pain. If bleeding continues without pain, that's actually more of a sign to suspect colon cancer, so please keep that in mind. And there's one more important thing. If you experience bloody stools for the first time after turning 40, even if you have symptoms of hemorrhoids, you can't rule out bleeding from colon cancer, so you should definitely get a colonoscopy. If you just assume it's hemorrhoids, that self-diagnosis can allow the cancer to progress to a more advanced stage. 7 shared traits among people who die from colon cancer. Next, the 4th thing they have in common, they've never had a colonoscopy at all, even though they're over 40. Is anyone here like that? I have some data to share with you all. In the United States, the guidelines changed in 2021. It's about the suggested age for colorectal cancer screening. Until now, it was 50 years old, but the age was lowered to 45. The reason is, Basically, it's because colorectal cancer among younger generations is rapidly increasing. Even in Japan, the incidence rate of early-onset colorectal cancer among people aged 20 to 49 has been on the rise over the past decade or so. It is said to be increasing by about 3 to 5% annually, and there are even additional reports confirming that this trend continues as of last year, 2025. The numbers keep going up. Since colorectal cancer is rising among younger people, waiting until age 50 for screening means more are checked too late. And this is an important point for those people. Which should they get, the fecal occult blood test or a colonoscopy? With a colonoscopy, you can actually check inside the colon to see if there are any polyps or cancer. Polyps can be removed during the procedure if found. In that sense, colonoscopy is more accurate than fecal occult blood tests when it comes to not missing cancer. However, since there are factors like pain and the time it takes, it's perfectly fine to start with a fecal occult blood test after weighing those considerations. I hope you'll consider getting one of these tests. If your first test finds nothing, especially if you're young, you may be told to wait 5 years for the next one. If you think about it, getting peace of mind for 5 years with just one test is actually a pretty cheap investment. 7 common traits among people who lose their lives to colorectal cancer. Here's the 5th one. These are people who had polyps removed but are skipping their regular checkups. Even though they had polyps removed in the past, they actually neglect their follow-up exams. There are occasionally people like this. Do you think you're safe just because you had a polyp removed once? Actually, it's the opposite. If you've had a polyp found during an exam once, even if it was removed, you're more likely to develop another polyp. Some colon polyps are benign, but if left untreated, they can gradually grow and eventually turn into cancer. According to the guidelines of the Japan Gastroenterological Endoscopy Society, after a polyp has been removed, it is generally recommended to have a colonoscopy within 3 years. However, based on the size and quantity, after examining the removed tissue under a microscope for malignancy and other factors, the frequency of your next colonoscopy may change, so please consult with your doctor to decide together. Please make sure not to forget the next examination instructed by your doctor. Be sure to mark it on your calendar or save a reminder on your phone. Because it's easy to forget if it's 3 or 5 years later, it's important to note it properly. 7 common traits of people who lose their lives to colorectal cancer. The 6th common trait, processed red meat is on the table every day. There's a fact I want you to know here. The World Health Organization, WHO, and the International Agency for Research on Cancer, IARC, made this announcement in 2015. Processed meat has been classified as carcinogenic to humans. It was placed in that group. Processed meat includes ham, sausage, bacon, and salami. In other words, it refers to meat products that have been processed with methods like salting, smoking, or adding preservatives. According to research, eating 50 grams of processed meat every day is associated with about an 18% increase in the risk of colorectal cancer. 50 grams is about, in terms of ham, that's about 3 to 4 slices, or about 2 sausages, so it's actually not that much. In fact, the average daily intake of processed meat for Japanese people is about 13 grams. So compared to the rest of the world, that's actually quite low, so it's not bad to eat ham occasionally. So everyone, please take a look at your own lifestyle habits, and if you think you're eating a lot of processed meat, try to cut back. It might help prevent colorectal cancer in the future. If you're having bacon for breakfast, ham in your lunchbox, and sausage for dinner, and this keeps happening day after day, please try to be conscious about reducing the amount. I'll explain specific ways to cut back in the 3rd part. A common trait among people who lose their lives to colorectal cancer. There are 7 common traits. The 7th is that a lack of dietary fiber leads to a poor intestinal environment. I'll give you the conclusion first. There's no downside to consuming dietary fiber. Is there a connection between dietary fiber and colorectal cancer? In a study conducted in Australia in 2011, which compiled data from about 2 million people, those who consumed 10 grams more dietary fiber per day tended to have about a 10% lower risk of colorectal cancer. And there's also an interesting result from a study conducted on Japanese people. This is a study by the National Cancer Center. In fact, when people were divided into groups based on the amount of dietary fiber they consumed, the group that consumed the least dietary fiber had the highest risk of colorectal cancer. However, the group that consumed more dietary fiber than the middle group had a lower risk of colorectal cancer. But the results didn't show that the more vegetables you eat, the lower your risk of colorectal cancer, so it might not be that simple. As I mentioned at the beginning, do you remember the 2025 study in Nature that I mentioned earlier about the gut toxin called colobactin? Colobactin is a toxin that can be produced by certain strains of E. coli in our large intestine. And this toxin damages DNA, damages our cells. Recently, colorectal cancer has been rising among young people in Japan. It is believed to be due to the toxin called colobactin. However, as a point of caution, this is still a field where more research is needed, so there isn't enough data yet to discuss things like how to reduce E. coli that produce colobactin. However, dietary fiber still seems to be the key. That's because dietary fiber serves as food for the gut bacteria. When there is plenty of good dietary fiber to serve as food for the gut bacteria, the intestinal balance changes and the good bacteria become dominant. And it's believed that this can help suppress the overgrowth of bad bacteria. In other words, by consciously consuming dietary fiber, even if not directly, you can improve your gut environment, which may ultimately reduce bad bacteria and help protect the colon from toxins produced by them. So I encourage you to make sure to include it at least once a day. Try to have about a small handful of vegetables at least once a day. How was it? I introduced 7 common traits of people who lose their lives to colorectal cancer. If you found any of this helpful, please give it a thumbs up, and if you found it even a little bit useful, please subscribe to the channel now. Well then, 3 words. So far, I've gone over 7 things they have in common. If you're concerned some of these apply to you, don't worry. There is hope. If you take action at the right time, the risk of dying from colorectal cancer can be greatly reduced. To help with that, I'll introduce 3 actions you can start taking today. Please try to start at least one thing that you think you can do. Action number 1. If you are 45 or older and have never had a colonoscopy, first, talk to a healthcare provider. You probably think colonoscopies are scary, time-consuming, and expensive. That's true. However, with recent colonoscopies, some can be finished while you're asleep. In that case, you hardly feel any pain. If you have insurance and pay 30% of the cost, the examination usually costs around 10,000 yen. Depending on the clinic, some places allow you to do it as an outpatient, while some hospitals may require a 1-night, 2-day stay. In large-scale global studies, this colonoscopy has been shown to... There are even reports that it is the most effective test for reducing future mortality rates, so it's a very important examination, and if nothing is found during the test, the next one will be 5 years later. You don't need to have it every year. So please consider getting a colonoscopy for your peace of mind. There are actually hospitals that offer gastroscopy and colonoscopy as a package. When done together, after swallowing the gastroscope, they can give the laxative directly into your stomach through it, and then... There's also a method where you completely empty your bowels and then undergo the examination. That way, you might not have to drink a large amount of laxative before the colonoscopy, so there are various new methods available these days. Please look into them. Here's the second action, your daily diet. Eat processed meat 1 less time per week. Instead, be mindful of your fiber intake. That's all there is to it. For example, just reducing bacon at breakfast, ham in your lunchbox, or sausages at dinner by 1 day a week is enough. Eating is one of life's pleasures. If you push yourself too hard and can't maintain it, it won't matter in the end. Set realistic goals and follow through. Share your commitment in the comments. You don't have to aim for perfection when it comes to vegetables either. For example, you could try adding a seaweed salad to your lunch today, or mix some brown rice into your dinner to increase your fiber intake. It doesn't always have to be a salad. That small step, taken over many years, will become the foundation for protecting your colon. Action number 3, if you notice blood in your stool, don't try to judge it yourself, just go see a doctor. Even if you have symptoms of hemorrhoids, even if you're young, or even if your fecal occult blood test was negative, if you see blood in your stool, that is, if you notice blood on your stool, be sure to see a gastroenterologist. You might think it's just hemorrhoids, or you might feel embarrassed. Thinking things like, maybe I should just watch and wait, or making these kinds of decisions on your own can ultimately lead to the disease progressing to a more advanced stage. So please make sure to share this information with those around you and keep it in mind yourself as well. Never make a decision on your own. If you notice blood in your stool, see a doctor immediately. Now let's review the 3 actions. First, if you are 45 or older and have never had a colonoscopy, talk to your doctor this month. Second, Reduce processed meat even by 1 meal a week and be mindful of dietary fiber. Third, if you notice blood in your stool, don't decide on your own. Be sure to see a doctor. Please share your experiences with fecal occult blood tests or colonoscopies you've had in the past. I think it will be helpful for other viewers. Here's a summary of today's talk. 7 common traits of people who lose their lives to colorectal cancer. Number 1, they feel reassured by a negative fecal occult blood test. Number 2, they only see a doctor after symptoms start to appear. Number 3, they think blood in their stool isn't serious and ignore it. Number 4, they are 40 years old or older and have never had a colonoscopy. Number 5, after having a polyp removed, they skip regular checkups. Number 6, eating processed meat is now a daily habit. Number 7, a lack of dietary fiber is disrupting your gut environment. Colorectal cancer is indeed continuing to increase. However, if it's found early, it's a cancer that can be cured, and by improving your lifestyle habits, you can also lower your future risk. Let's protect our health together with knowledge and just a little bit of action. In a society overflowing with information, it's important to have at least one reliable source. If you like, please subscribe to the channel so you'll get notifications of new videos. And it also motivates me to make more videos. I would really appreciate it. And one more thing. Here's a summary of today's lesson. I created a colorectal cancer self-checklist. Please sign up for the official Line account and enter Chokatsu in hiragana. I've summarized 7 common traits of people with worsening colorectal cancer, 3 recommended actions, test timing, and monitoring guidelines on one A4 sheet. I'll send it right away, so please register if you'd like. If you enjoyed this video, please rate it by hitting like or dislike. Leaving a comment, even a word about what you learned, can help you remember it. See you in the next video.